If you want to know about men's health, stay tuned. I'm a urologist and pelvic surgeon, and today we're going to talk all about sexual health. So if you've been having issues with getting an erection or keeping an erection or having issues with ejaculation, low libido, all of these things can be signs of low testosterone. And in fact, there are very few symptoms that are specific for low testosterone. What I mean by that is a lot of these symptoms can also be explained by other things like depression, stress, anxiety, which are very common, especially nowadays. In fact, when you look at studies of men who have what we call hypogonadism, or low testosterone, about 20% of them have issues with erectile dysfunction. About 30% have issues with premature ejaculation, and about 50% have issues with either decreased libido or erectile dysfunction, or both. So, how do you know if you have low testosterone? Well, it's not as easy as you might think. So the symptoms of low testosterone tend to be very vague, and they tend to be more things that bother you, rather than specific symptoms that you can point to and say, and how bothersome they are to you, as well as what your testosterone levels are. And as always, remember to take care of yourself because you're worth it. There are multiple treatment options available, and we'll talk more about them in my next video. Hey, this is what's wrong with me. It is really important that we identify if these symptoms are bothering you, so that we can treat them appropriately. So some of these things include decreased libido, erectile dysfunction, difficulty in concentrating, feeling sad or depressed, decreased energy, fatigued, changes in body composition. Specifically, you may notice that you're gaining fat, especially in the belly area, and you may also notice that you're losing muscle mass and strength. If you are having these symptoms, it's really important to go see your primary care doctor and have a conversation with them. There are multiple ways to diagnose low testosterone, but the easiest way is to get a blood test and measure your testosterone level. However, it's important to realize that testosterone, like all hormones, fluctuates throughout the day, and so getting a single measurement may not be truly reflective of your testosterone levels. That said, there are some specific guidelines, and if your testosterone is less than 300 nanograms per deciliter, then you likely have low testosterone. How do you treat low testosterone? Well, that depends on a number of factors, including how severe your symptoms are. If you enjoyed this, please make sure to share this channel with your friends.